Edward Jenner. He is a man that will never be forgotten throughout the course of our history. Responsible for saving the lives of countless millions of people, his earth-shattering and revolutionary research into the field of immunology has had a timeless impact to our world until today. His work remains as the foundation of all modern-day immunization research and discoveries. And most directly, he has helped rid the world of the harrowing smallpox disease.
Of all the tragedies that have befallen upon mankind, smallpox remains to be one of the most deadly. Contagious beyond any belief, once infected with the virus, painful pustules are left on the skin of the victim, and there is a 1 in 3 chance of death. If there were any survivors, they were permanently scarred and in some cases blinded for life. Lord Macaulay of 18th century England calls it the most terrible of all the ministers of death. Smallpox was always present, filling the churchyards with corpses, tormenting with constant fears all whom it had not yet stricken. The airborne virus, called the variola virus, has taken the lives of more than 400 million people worldwide just from the 20th century alone. That's not including those who were succumbed to smallpox during the previous centuries. In the 1500s, the Aztec civilization was obliterated due to the introduction of the smallpox virus by the Spanish conquistadors.
People were scared of smallpox. They were scared of death. No one dared to step inside a house that had been struck by smallpox. Not even doctors wanted to go to these houses.
With so many people falling victim to smallpox, and with no effective treatment or cure once contracted, there had to be a way to protect the world from the horrors of smallpox. One man came to the rescue. His name was Edward Jenner. Jenner was an Englishman who studied a variety of scientific fields for several years before he came to the conclusion that medicine was his true calling. He returned home from London in 1773 to the countryside of Berkeley, Gloucestershire, to carry out his career of being a doctor. It was there that he made a groundbreaking discovery. He noticed that in a time when smallpox was rampant throughout England, milkmaids remained unharmed by the disease. He hypothesized that it was because of their contact with cows infected with cowpox, a milder cousin of smallpox. On May 14, 1796, Jenner tested this hypothesis on the 8-year-old James Phipps. He extracted pus from the cowpox pustule from the milkmaid's hand and inserted it into the arm of young Phipps. Phipps now had cowpox just like the 2 milkmaids. 2 months later, as quoted by Edward Jenner, in order to ascertain whether the boy was secure from the contagion of the smallpox, he was inoculated the 1st of July following with variolous matter, immediately taken from a pustule. James was deliberately inoculated with the smallpox virus, and remarkably, he didn't contract smallpox. This amazing event proved Jenner's theory of immunization and marked the discovery of the first smallpox vaccine. In fact, it was the first vaccine for a disease ever, and was named vaccine from the Latin word vacca, meaning cow.
Well, Jenner's work in the 1700s was really groundbreaking because he showed that cross-immunity from one virus to another could protect humans. So cowpox was not dangerous. People got cowpox, and it just was a pock lesion on the hand, mainly in dairy maids who were milking cows, and they never got sick from that. But he was able to say, hey, we don't understand virus. At the time we didn't know what viruses were, didn't know what bacteria were. At the time he knew that there was some sort of infectious agent, and the infectious agent in cows was protective against the infectious agent of smallpox.
Edward Jenner published his findings, an inquiry into the causes and effects of the variolae vaccine, in 1798, but was met with much initial skepticism, especially from the clergy. People feared this radical new idea of getting vaccinated would turn them into cows, as depicted in the satirical cartoon drawn by James Gilray in 1802. Soon after, however, people couldn't deny the effectiveness of his vaccine as a combatant to smallpox. Many countries around the world then began using his vaccine to protect their people. President Thomas Jefferson endorsed Edward Jenner in a letter saying that, "I took an early part in recommending it to my countrymen. Medicine has never before produced any single improvement of such utility." In his letter to Jenner, Jefferson continued to foreshadow an event that would ring true in the next centuries to come. "Mankind can never forget you have lived. Future nations will know by history only that the loathsome smallpox has existed and by you has been extirpated."
Jenner's cowpox vaccine was being readily distributed throughout the world within years of its discovery. Some areas of the world, such as North America and Europe, had more developed healthcare systems, and by the 1940s, they were able to rid their countries of smallpox. Other less developed countries, unfortunately, did not have the resources to do as the other countries did, which meant they were continuously struck with smallpox epidemics, which continued to kill millions. The epidemics could then spread to other places, which were already smallpox-free. Smallpox was still a major threat to the world, and something was needed to make it stop. The World Health Organization, or the WHO, answered that cry for help. In May of 1966, the WHO, headquartered in Geneva, Switzerland, made the decision to officially begin a global smallpox eradication campaign to eradicate the world from smallpox in 10 years. At the time, there were 55 countries affected by smallpox, and most of them were countries with vast areas of land where some people hadn't even seen a healthcare worker in their entire lives.
The WHO used the newly developed bifurcated needles and the freeze-dried vaccines to vaccinate millions of people. Most importantly, they used the search and isolate method to vaccinate populations, which was very cost-effective.
And so our strategy was, let's use most of the vaccine in the villages where we know there's smallpox. But number two, let's try to outfigure the smallpox virus. I mean, we literally asked ourselves, if we were a smallpox virus bent on immortality, what would we do? And you have to find susceptibles to continue growing. So we figured out where are people likely to go because of market patterns and family patterns. We chose 3 areas that we thought were susceptible, and we used the rest of our vaccine to vaccinate those 3 areas. And now we're out of vaccine.
700 advisors and 200,000 health officials and volunteers rose to the occasion. The whole world joined together with one goal in mind: eradicate smallpox from the face of the earth. Members of the WHO scoured the world for any outbreaks of smallpox, even offering cash rewards to those who could provide information about a smallpox case. They vaccinated millions of people. 1967 marked the beginning of the smallpox eradication program. Their efforts were successful as each year saw fewer and fewer countries hit with smallpox epidemics. Finally, in 1977, the last case of smallpox was found in Somalia, Africa.
We thought we were finished, and we weren't. And all of a sudden we got a cable from indicating there were cases in Somalia right adjacent to Ethiopia. The government had suppressed the cases because they were embarrassed that these were the last cases in the world. And so the epidemic had started and grown, and it wasn't being stopped. On the 26th of October, 1977, Ali Milan had gotten smallpox, and that was the last case. And we figured that this was the last case going back 3,500 years, at least to the time of the pharaohs who died of smallpox, because smallpox cannot survive unless it goes person to person to person. And so he was the last link in this chain that going back at least 3,500 years.
The World Health Organization officially announced the eradication of the smallpox virus on December 9, 1979. The world was, and is still today, free from the horrors of smallpox. It would not have been possible without the relentless efforts of Edward Jenner and his discovery of the smallpox vaccine. Often referred to as the father of immunology, he was the foundation of discoveries in immunology today. Jenner's work also paved the way for medical breakthroughs in the immunization field. Jenner was an inspiration to many, and his work will forever be remembered.